And good morning for another live stream. I just want to start off this morning. I got an email the other day about this topic we're going to talk about today, whether or not it's just for list members. I just wanted to make sure everyone's aware it's for everyone. Doesn't matter who you are, where you are. Um, doesn't matter if you're a list member or not. This channel's for everyone. So anyone with a disability. Even though we have a topic today, you might want to come up and talk about something else, and that's perfectly fine. I'm more than happy to do that. So you don't have to follow the topics. You can come up and chat about anything you want. So I just want to make sure that everyone, that was clear for everyone. Um, Also, early next year, I've got a couple of things I'm organising now, which is to talk about mental health for people with disabilities, um, parenting as a person with a disability, and that includes being a single parent with a disability. I'm also trying to get a legal service to come on to a live stream and chat to us so people can ask questions and all that sort of thing if they're not sure, if they have a case of discrimination. So hopefully that'll be uh, either just before or just after New Year's. So, and I'm also hopefully our stream next week will be on a Tuesday at 9:30 New South Wales Daylight Savings Time, and we're going to be talking to the one and only Christopher Widows, aka Steady Eddie. So we're going to talk about um, his life story, how and why he got into comedy, what he's been doing over the last 20 odd years, and his battle. And that it was a battle for him to get onto the NDIS. As you know, Steady Eddie or Christopher Widows has cerebral palsy, and he actually had to fight to get onto the NDIS. So again, the NDIS comes into the forefront of, in my opinion, discriminating against certain people with different types of disabilities. I don't know why it was such a battle for Christopher to get on to the NDIS. So that'll be next Tuesday at 9:30. I will let everyone know before that. I'm just waiting for Christopher to confirm. So if anyone's in chat, there's a pinned link above the chat box where you can come up to the chat panel and talk about anything you want. But today we're going to talk about doctors and where they go wrong. I'm going to start by telling part of my story. In 1989, at the age of 25, um, I used to be heavily into weight training. I used to do it every day, a couple of hours a day, 5, 6 days a week. And I was training a young bloke and was down at PCYC, working on our legs that day. And the next day, I got up and I felt this slight twinge in my left hip. I thought I thought I just tweaked the muscle or did, just a bit sore from the previous day. So I went to work, and by that day, when I got home, it was a little bit sore. Um, and over the next few days, it got worse. The pain was quite bad in the left hip. I wasn't using my left leg properly, um, and I could feel it starting to go a little bit numb at the back of the leg. Um, and over the next week and a half, um, I ended up going to the emergency department because I could barely stand, I could barely walk, and I was in hospital. And my doctor, my GP at that stage, is a different GP to what I have now. Um, he was looking at me trying to work out what was going on, and over the next 2 or 3 days while I was in hospital, I became completely paralysed from the waist down. No feeling, no movement. My doctor was stumped. He reached out to other doctors in town. They come and looked at me. He reached to, different specialists that were in town. And there was one specialist who was a diagnostician. His specialty was he just came in, looked at people, and diagnosed whatever the illness was or disease was. He looked at me, couldn't move my legs, couldn't feel the pinpricks. He run the, I don't know, this pointy thing at the bottom of my feet, both feet. Told my doctor to come outside. Now, my bed at that stage was closest to the door. And in the bed beside me was a well-known person where I live. He's very well-known, respected and liked in this town. And I was listening to the specialist talking to my GP, and he said, "I can't find anything wrong with him. I think he's lying. I think he just wants a few days off work." And my GP at that stage said, "I know, just been coming to me for 6 or 7 years at that stage. I know about 5 or 6 years. And he only ever comes to me when he's sick, and he doesn't lie or exaggerate. So I believe him when he says he can't feel his legs and can't move his legs." And the specialist said, "Well, I'm telling you, he's lying. He just wants a few days off work and a bit of sympathy." And he walked off. And I looked over to the bloke in the next bed. I said, "Did you just hear what that dickhead said?" And he said, "Yeah, that wasn't good." And I said, "Why would he say something like that?" I just couldn't believe it. My GP then walked in. He said, "Oh, look, there's one more doctor in town I want to try. He's actually leaving town tomorrow. He's on his way to St Vincent's Hospital in Sydney to be in charge of the hospice down there." So the next morning, this doctor called in, looked me over, again called my doctor outside, and he said, "There's definitely something wrong. We're going to have to get into Sydney to do more tests. We just don't have the capabilities to do it here." So late that afternoon, I was on the air ambulance flying to Sydney. So I get to Sydney, they offload me, they take me to St Vincent's Hospital. I was because it was um, after 6 p.m., 7 p.m. when I got down there. They couldn't put me into a ward because of the time, so they left me in emergency. So I was put right up the back in the emergency department at St Vincent's Hospital. And every now and again, the nurse will come along and do the obs and make sure I was okay if I needed anything. And this was, I think it was a Thursday night, something like that. And I had the curtains drawn around me, and I could hear across the aisle and down one or two beds, um, this bloke was really drunk, and the doctor kept saying to him, "Keep your hands out of your wounds, I'm trying to stitch it." And this bloke's mumbling and carrying on. And the doctor said, "I'm telling you, don't touch it, I'm trying to stitch it." And he did it again. He touched his wound again. The doctor said, "Look, if you touch it one more time, I'm going to hit you." Anyway, at that stage, the nurse walked in and she was asking me if I was all right. And that's when you could hear this. I told you, then you could hear this whack, whack, whack. It hit this bloke a couple of times. Now, I know the doctors in the emergency departments in large hospitals, out of med school, they can do up to 18, 20 hours a day, 4 or 5 days straight, and they're overly tired. So I could understand that they're tired and frustrated, but there was no need to hit the bloke. And there was no need for the specialist to say that I was acting and putting it on, wanted a few days off work. And I was utterly disgusted. So the next morning, wardsman comes along. He says, "I'll take you for a shower before we take you up to the ward, to your bed." I said, "Okay." So helped me out of the bed into the wheelchair and wheeled me into this tiled room, and he helped me undress. And I was still sitting in a wheelchair, like completely paralysed and eyes down. And I was sort of looking around, looking for the controls for the shower and the shower head, and there was none there. And I turned around and looked at the bloke, and he's got this huge hose in his hand. And that's when full force with this hose, hosing me down. Not a shower, I was hosed down. So I just sat there and I just put my chin on my chest to keep the water, so it didn't hit me in the face. And after he turned the hose off, I looked up at him and said, even cattle don't get treated like that in the slaughter yards. And the bloke just gave me a dirty look, got me dressed, took me back to emergency, put me in the bed. They took me up to the room. And I was there for, till the next day. The specialist came along, examined me, ordered all these tests. And none of them come back with any positive identifying markers for diseases or illnesses. And they decided to do a lumbar puncture and take some spinal fluid out and inject the dye and to check the brain and the spinal cord. So they took me to this room and they helped me onto this bed that was probably, it wasn't, my hips were wider than this bed was. And it was a wood bed, very little padding. And up towards where the head was, there was like two arms. It was like a crucifix. So I was lying face down. I had to put my arms out in the crucifix position with my palms facing the ceiling. They all strapped me down. And the next minute, this doctor walked up and he said, just lift your head a little bit. So I lifted my head and he jammed his wedge under my chin and it pushed the back of my head so it was resting on my back. And then they began the lumbar puncture. And they put a local in, put the large needle through the skin until it got to the bone, and they just twisted it. And they kept doing that until they bored their way through the bone. So, this is extremely painful, really uncomfortable. I was strapped down, couldn't move. And then they took the fluid out, injected this dye in, and they said, we're just going to tilt the bed a little bit. So this crucifix bed sort of tilted forward, back, side to side, forward, back, side, for about 2 or 3 minutes. And this made the pain that I was in a lot worse. So I was laying there and I was bawling like a baby. I had tears and snot flying everywhere. They stopped the bed so it was still level. They brought a machine over, took x-rays or pictures or scans, whatever they did, unstrapped me, took the wedgie out from underneath my chin, slid me over onto the bed, rolled me onto my back, and they said, you have to lay flat in your back for 24 hours. Otherwise, you're going to end up with a really bad headache that we can't do anything for. So I said, okay. So they took me back up to my room, and the next day, this registrar came through, and there was 2 or 3 people in the room, and there was, they had visitors. And this doctor come in, and he said, we've done all the tests. We checked you for everything. We even checked you for the clap, which you didn't have, but we thought we'd just check you anyway. But we did find, when we did the scan on the spine and the brain, we found a tumour in the spinal cord. It's a malignant tumour. Then I just went numb, and I was just looking at him, and I could see his mouth moving, but I wasn't actually hearing what he said. And then he stopped, and then I heard, do you have any questions? I went, well, no. And he turned around and walked out. That was it. They told me I had a malignant tumour in the spinal cord. Didn't give it any time for it to sink in, and he walks out. anyone who's ever been put in a position like that understands that when you're diagnosed with something like that, you're stunned. It takes a little bit to sink in. So I had to wait till the next day until the specialist came in so I could ask some questions. But that was the start of my experience of going in and out of hospitals over the last 33 years. And I truly, truly hate hospitals up here. I'm known as a runner. I had an operation. I was supposed to be in for a week. I left on the third day. I just hate hospitals. I hate the way I was treated. I hate the way they smell. The hospital up here where I live now in Armidale, the nurses are really good. The younger doctors, who are learning, arrogant. I fell over last year on Father's Day and broke my left hip. Had to have a rod put in and a few screws. And this little twit upstart medical student comes in. Oh, you've got osteoporosis. I said, yeah, I know. I've had it for 20 odd years. And he said, well, you need to be on something like Fosamax. And I said, well, I was on Fosamax for years, but I stopped. He said, well, you need to go on it long term. I said, no, you can't go on it long term. He said, yeah, you do. Actually, no, you don't. If you check with the company who makes it, you should only stay on Fosamax for 2 or 3 years, go off it for 4 or 5 years, then go back on it. Otherwise, it makes the bones become more brittle. No, that's not right. And I said, well, you're wrong. And he turned around and walked out. And this happened last year, Father's Day, or 2 days, 3 days after Father's Day. Couldn't believe it. And this little twit who wasn't even born when I first started going in and out of hospitals is telling me what I need to know. I already know it. I just get really frustrated with medical professionals who don't listen. They might know a lot about the human body, but not about mine. I know all about it. I know what hurts, what doesn't hurt. I know what triggers stuff. I know when I have many MS attacks. I was diagnosed with MS in 92. I know when those attacks are coming on. Doctors don't know everything. And, they need to learn that. Another good example, when I first contracted MS in 92, so the tumour was 89. I contracted MS in 92. It attacked the optic nerves. That's how I lost my sight. But when I first lost the sight in my left eye and my right eye was going, I was rushed to St. Vincent's Hospital again. And the specialist didn't know what was going on. Anyway, they took me into this conference room in a wheelchair. They introduced me, went through my medical history, said I lost the sight in the left eye, the right side eye, the sight in the right eye wasn't all that good. And the doctor at the back just piped up and said, just pop his left eye out and scrape the optic nerve. So I just looked up at him. I said, just pop your own effing eye out, mate. Don't pop my eye out. You could have heard a pin drop. Could have heard a pin drop. You can't question doctors, especially specialists that, they think they know everything. But I don't know if anybody else is out there. I had an email yesterday, the day before, who had a friend who's the disabilities gone through traumatic surgeries and, had bad interactions with doctors. I'd like to hear from anyone else who's had a problem like this or had their own problems with doctors, whether it's a GP, a specialist, or an eye doctor, or neurologist, whoever. Yeah, I find it interesting to hear other people's stories about this. And I had a quick look on YouTube for when doctors go bad or go wrong, and there was quite a few videos in there. Not many with people with disabilities, a couple there, but I didn't have time to put them in my library and able to show them this morning. So I don't have any videos for that today. But if anybody's there and is listening, wants to come up and have a chat about this topic or anything else, please feel free. Chris, what are your experiences with some doctors?
Well, I think I've had numerous experiences with. My kids had juvenile asthma when they were younger, and we had lots of issues. We had a fairly good GP who knew what the issues were with my children, but often you sort of present to hospital because you know what the symptoms are and you've gone through the process and you've got a very specific, when a kid's having a juvenile asthma attack, then you have to look for certain symptoms and wait for a certain period of time and then administer certain drugs at a certain time, and then you go to hospital, and sometimes the people there would be triaging and go, okay, you've gone through this process, okay, we need to take it further. But my kids always, even when their oxygen levels were quite low, they bounced a lot. Like they were very active, and the triage person would go, no, your kid looks like they're fine. I'd say you've got to take their oxygen levels. Oh, no, I don't think we need. No, you need to take their oxygen levels. And then as soon as they do that, they'd take them straight into the ward and give them prednisone and put them on oxygen and things like that. So it was kind of, you just get sick of it after a while. You sort of go in and I said to my GP, can I get a letter or something that just says, can we just go in? Because, you've been through an emergency, you're sort of fairly traumatized, been through emergency situations. The kids have, really struggling to breathe. And then, just time after time, you go in there, going into the trip into hospital, they get a bit of adrenaline in their system, so they look like they're okay, but they're actually still at quite a level of risk. And I guess in that situation, you don't have any option. You're at the hospital, you've got the person in charge of triage, and you need to, you feel like you need to convince them that there's something wrong with your child rather than just presenting your child there, which was very frustrating. And I'd say to them, but eventually I reached the point I actually knew most of the staff there, so that was fine. You'd have another staff member who'd come along and go, oh, Chris, what are you doing here? Didn't we see you last week? It was a bit of a sad situation to be in, but it's very frustrating when you have to try and feel as though you need to justify to the doctors that you are actually sick. But I think the issues, like there are some doctors that they're absolutely fantastic and they're very open to suggestion, and they see themselves as trying to manage or negotiate the situation that you're in. And there are others who, like you're saying, they're a bit arrogant, a bit full of hubris. So they can come along and they say, oh, I've got this experience at medical school. I know what's best. I know better than the patient. They say something, but then you don't go back to them. And I think this is part of the problem, is that they never get that feedback. They very, very rarely would a patient come back and say, actually, you got it completely and utterly wrong. I presented with symptoms. You didn't even do a full examination. It turns out that I was seriously sick. I did say that I was seriously sick. You didn't believe me. I went and saw someone else, and it turns out they identified what the problem was. But no one ever goes back. Now, the difficulty with people with disabilities, Jeff, is that most people I know with disabilities already kind of feel like they're being dealt with as second-class citizens by a lot of people in society. So they are less likely to complain. They're less likely to put their hand up. They're more concerned. They're in a vulnerable situation. They're more likely to just keep on going and just not make any complaints. They're less likely to go and seek other medical advice because they feel as though, oh, well, I've done what I need to do. I've gone to the doctor. They're less likely to complain, and they're really worried about having retribution because a lot of people I know with disabilities, they find that when they do make complaints, they're in a vulnerable situation. And sometimes there is retribution for making complaints because they see you as being a troublemaker. This is something that I think most people I know they've had a disability long term have experienced in one form or another. So especially people with disabilities in vulnerable positions um, need to have advocates to sort of help back them up and help support them, because otherwise they don't get anywhere. And it's that reinforcement. It's the reinforcement. You go, the doctors come in, they say, oh, at one glance you've got blah blah blah, and then they walk out and they don't ever hear from you again. So they think, oh, this has been a good day. No one's ever told me that I'm wrong. So therefore I must be right. I think it's that negative reinforcement. As I said, this is not all doctors by any measure, but there's certainly quite a few I've come across that have had this issue. And for people with disabilities, it just means they've got no chance at all.
Yeah, look, absolutely. It's hard for a person with a disability who has been treated the whole life as a second-class citizen who can't make an informed decision, or that they're perceived as not being able to make an informed decision. But where do we go? Who do we turn to? You know, I've made numerous complaints to the way I was treated over the years. They protect their own. It's like the police when you make a complaint against someone in the police force. They investigate themselves and they never find any wrongdoing. So, yeah, who do we turn to? Who do people with disabilities turn to when they're not being listened to?
Yeah. At least now there is, I've noticed in the hospitals now they have posters to say there's an escalation line. So they say at any point in time, if you feel as though that you're not being listened to uh, by the uh, by the nurses or by the doctors, then you can call a phone number, and according to the poster, you get someone on the phone straight away, and they will contact the people involved within a certain time frame. I can't remember what it is. It's like 15 minutes or half an hour or something. I've never gone through that process myself. Fortunately, in more recent years, I haven't had too many real issues with doctors, not to the extent that I did when the kids were young. But at least there is that avenue. So if you do find, if you are in a hospital, I think I've seen them in doctor surgeries as well, but I definitely see them in hospitals. Is that you can call that phone number, and you can actually say, no, I'm not being listened to. I feel as though at the moment I'm at risk, which is good because that was never an option in the past. I guess that they've realised that there are people who've ended up getting seriously worse or passing away because they just weren't being listened to. Um, yeah,
I've never seen those posters. I've never been informed that there's that um, opportunity to make that phone call. Yeah. Now, why aren't the staff notifying um, patients with disabilities that's available who can't see that poster? Um, yeah, when I broke my hip, I've got 8 crushed vertebrae from T4 to T12. I can't lay flat on my back for more than 10 to 15 minutes without ending up going in severe pain. Um, so as soon as the paramedics got there, I told them I can't lay flat on my back. I got to the hospital. The paramedics told them I can't lay flat on my back more than 10, 15 minutes. I told them the same thing. And after about 4 hours, I was in so much pain I could hardly breathe. I couldn't move because of my hip. And because I was complaining, the doctor got upset with me.
Well, this is a very valid point. When if people aren't informed when they're coming in, there are posters on the wall, but maybe there's a lot of people use electronic devices, especially people with disabilities use electronic devices to be able to communicate. Maybe when you come in and you put all of your details in, if you got, say, if you got a message, an SMS that said, um, you know, you've just been admitted to such and such hospital. Um, you'll be, you'll go through a triage process. You'll be seen to as soon as possible. If you feel as though you're not being listened to, then you can phone this number. If you're a person supporting someone else, then so if you come into the hospital, you could put, because I don't know if they put in the phone numbers of people who are supporting, but they could get the phone number of someone who's supporting the person. So the person who's supporting can also get that message to say, if you feel as though you're not being listened to at any point in time, or mistreated, then you can contact that number. If they had that kind of a system, then it would be a good way of relaying information to people. Not everyone has a mobile phone. It would be good if they verbally, let you know when you came in as well. It's not, depending on what condition you've got, you're not always in a position to be able to be informed of that, but it could certainly be done a little bit better.
Well, I know here in New South Wales, and I think in most states, hospitals and doctors, they share files. So they can pull up your file in a hospital, go through your medical history, find out who your next of kin is or a contact person, but they never come in and talk to you and say, look, you know, if you have an issue, you can call this number, or you can get your support worker, carer, or family member, whoever, to call that number for you. The information's not there. I was lucky. My daughter's a nurse and she worked up here. And the doctor, um, she was telling him that giving me a certain medication wouldn't help because I take it all the time. And he just would not listen to myself and to my daughter, who's been a nurse for a few years. She's very good at her job. Even she got upset with the doctor. So, yeah, I don't know what the answer is, but, you know, I'm not the only one that's gone through this. I mean, you've gone through it with your kids. I think a lot of people have gone through it, but, I think the doctors, when they go to university, I was talking to a doctor a few years ago, and his son was just got out of medical school. And he said when he went to medical school, he had professors, and his son was just got out of medical school. They don't have professors anymore, they have facilitators. And I said, well, what's the difference? He said, I don't know. But I think they need to be taught at the very start, at the university level, to listen to your patients, to give them all the options. I know there's a service here in New South Wales. You can get I think it's once a year, you can get a medical professional to come around to your house, and they go through your medications and they talk to you about the side effects of each medication. And that's a free service. You'd probably call your chemist for that one to get more information. But yeah, if there's anyone listening who wants to come up about this issue or another issue, please feel free. Is there anyone in chat or?
No, we don't have anyone in the chat at the moment.
Oh, bugger it.
Um, I know it's well, one of the problems. The doctors are there's not enough doctors. And the doctors we do have are doing too many hours, which creates a lot of these problems. They don't, well, there are some doctors who just aren't really listeners. But there are some that are really good that just are very pressed for time. I had another time recently with my kids taking them to hospital. My daughter had a muscle in her arm had gone really, really tight and really hot, and was kind of a fairly unusual thing. She was in a lot of pain, and it meant that she was difficulty moving her neck and things as well. And um, so I took her in, and I had the first doctor said, "Oh, I think she might have a virus in the muscle." So I went, "Okay, well, this explains it being hot, and I don't know anything about this. This is completely new to me, so that'd be fine." So they're like, "Okay, well, we need to go and check a few things, and I'll be back in a second. I'm actually just finishing my shift, so I might put someone else on as well." And we were left waiting in the room for 15 minutes, and she had an ice pack on her arm to sort of cool it down. And another doctor came in and said, "Oh, so you've got a muscle sprain." So, well, the other doctor said that we had this thing, and then she started looking at, "Oh, maybe you've got tendonitis." Like, okay, I don't know what that is. Like, you're the doctor. What do you have to do? They did um, basically no physical examination at all. No blood tests, no anything. It was just like each time someone came in through the door, it was like, pull a name of an arm condition out of a hat. And eventually the person who was there said, "No, I think it's definitely a sports related." So, well, she hasn't done any sport and she didn't injure herself, and she does regular sport all the time, but I didn't know what that could be. "Oh, well, just have some Panadol and go home." And I said, "Well, but what's what should I be? Is it something else?" The other person said it could be this. What if it is that? What should I be looking out for? Is there I was sort of leading the doctor by the nose, going, "Well, if if it is something else, what are the triggers that I'm looking for to then come back into the hospital? Or, um, what are the things that should be fine?" It's not like any muscular injury I'd had before, where it was just the muscle had gone super tense and it was really hot. Um, and she said, "No, no, no, you're all good. You should go home now." And I went, "Okay, fair enough." And eventually it resolved itself. It's just kind of, I guess there were quite a few people there. She didn't have a lot of time. I could see that she was feeling like she had to run off and see the other people. It was not a life-threatening situation, but it's certainly a concerning situation. Um, and it just sort of panned out the way that it did. I find this kind of thing is fairly common too, where in terms of managing conditions, especially in rural areas where you've got very few doctors, very long wait times and things, is that um, we've got long-term conditions. Some doctors, you'll say, "Okay, this is a long-term thing that I have. Let's work out a management process." And some people I know that have just been sort of sent home, "Oh, you have such and such," and it's kind of up to them to manage the condition themselves. Um, Once again, going back to people with disabilities, if you're a person with a disability, if you're a person who's with a disability who gets regular supports, then you're often in a situation where you need other people's help to be able to manage a situation. So, if you don't know that you need to manage it, if you don't know that you need to step up, you don't know that you need to follow up with repeat visits and things, then you just let it slide, and it ends up becoming people with conditions who end up getting much worse than they ever should have been, which then puts more of a load on what is an already stressed system. So I don't know, maybe there's a solution there of having intermediary health people, even people who are centrally located, who could even on the end of a phone, who can help you manage these situations, who have some medical experience or have medical resources they can draw upon to to talk to other doctors to say, is this something that they need to follow up with their GP, send people reminder notices, things like that. I'm sure there's just better ways of doing it to help people help themselves. That don't just mean getting more doctors. It don't just mean getting people already stressed and doing extra hours, who can communicate and be like, go-betweens with the doctors.
Exactly, and you could just imagine someone who has communication problems going to a hospital trying to explain what the problems are. They say from 1 to 10, how bad your pain, or what are the symptoms, and what are you going through? What does it feel like? I think the doctors need more training in this area, especially uh, for people with disabilities with you know different kinds of communication disabilities. I could only just imagine how hard it would be to try and talk about what the problem is, and trying to be specific and concise without being treated like a second class citizen, or unable to make an informed decision, or they just don't have the time to sit there and wait for a person to communicate in the best way possible for them. Um, it's bad, and it goes back to the old, the doctors say when they don't know what something is, oh, it must be a virus. That's probably the oldest story in the book. But yeah, do we need to give the nurses going through university, you know, an extra couple of months on communication, interacting with people with disabilities? Um, do the doctors need that sort of training as well? It'd be good to get some feedback. It really would. Um,
Well, this is a thing I think when you talk about nurses, Jeff, is I think when I've assisted with supporting people in a hospital situation is the with support workers, so the people I've worked with have got quite rigorous training in how to talk to people, how to work with people, um, how to treat people with disabilities with respect, and also enabling them and empowering them to be making their own decisions. And I've gone into a hospital situation where the nurses have been talking to me, not the person, and they say, "Oh, they keep on making lots of noise." If someone's got, someone's it's a person with autism, and they might verbalize, and they might have behavioural issues, and the nurses have turned around and said, "Oh, they keep on making noise, it's disturbing other people, and if they don't start behaving themselves, they'll be sent home." And you kind of go, "Well, like it's not my job." It shouldn't fall back on the support worker to turn around and say to them, actually, you have a duty of care to look after this person. But they come as a complete package. They are a person with disabilities, with a person with, um, some type of autism, or they can have uh, all kinds of behavioural expressions and things. This is the part of the package and who they are. They've come in here for care. They need help. Often it's people who are in emergency situations, and you can't just turn around and say they need to stop having these behaviours relating to their disability. Otherwise, we're going to turf them out on the street. You've got a duty of care there. And I shouldn't be explaining that to nurses. I have seen that with people before. And there's, even with follow-up appointments and things with the doctor, if there's a support worker, they often, the person being supported doesn't want the support worker there in the actual doctor's appointment themselves. Some doctors are very good in knowing how to deal with that situation and what the duty of care is there. A lot of people assume that, oh, well, you have a support worker, so they're just there to manage everything for you. They're not. They're like if you've got a support dog. The thing is, they fulfil a very specific role in different situations, and they fulfil whatever the role is that the person wants them to. And if you've got a person with a disability and they don't want someone telling them when they should and shouldn't be going to the doctors, then it can be difficult to work out where the line between restricted practices and duty of care sits. And specifically in that situation, you need to be sure, or the doctors or someone should be sure, that the person's getting the level of care that they need, um, because otherwise it can be life threatening.
Exactly, and the issue of restrictive practices and duty of care. Now, I've had this argument with numerous people over the years, um, and with teachers as well when I was doing my TAFE courses, in disability services and community services. You know, the duty of care, in particular, is an individual thing, um, and restrictive practices. There's a lot. There's a lot that goes on that both direct and indirect. Um, where privacy and, like you said, the dignity of the person with a disability and their right to privacy and confidentiality, and often doctors and nurses will talk in front of everyone and anyone, and especially around people with disabilities, because if they're seen as um, not being aware or not being able to talk for themselves, they don't show them that privacy and confidentiality. They leave them uncovered. They leave them out in the open. It's just, I've seen a lot of things over the last 33 years, and generally the healthcare system is good, um, but there are areas where it can improve, and I just don't want to sit here and bitch about every doctor and every nurse, because the overwhelming majority of the nurses are fantastic. I've only come across a handful of nurses that are quite bad. They should have retired years ago. They're impatient. They don't listen. Some doctors have that God complex where you can't tell them anything. Uh, I went to holidays to the Central Coast and I forgot my medication, so I had to go see a doctor down the Central Coast. And the doctor I went in and seen was an Indian doctor, um, and said, I left my medications. What do you take them for? I have this, I have this, I have this, I have this. No, that's wrong. I went, well, what do you mean? He said, that's not the right medication. And I said, well, no, that's the only one that works for me. And he said, well, you're wrong. I said, no, this is what the specialist has done. This is what we worked out, what works best for me. He said, well, I'm going to change your medication. I said, no, 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 you're not listening. I just need for you to just for 2 weeks supply. And he says, no, you don't talk back to me. I'm the doctor. You're just the patient. You got to listen to me. So I stood up and looked at him and I said, yeah, well, stick it, turn around and walk to the door, turn back. Said, by the way, I'm not paying for this session either. And I walked out and left. It's that sort of God complex and that class system, and the good old private school boys and girls, and yeah. But when you have a disability, you're behind the eight ball straight away, and we need some sort of code of conduct for doctors and nurses and interactions with people with disabilities and communication. I think there needs to be a lot more work done in that area.
Well, I think I think actually on the Privacy Act, there's a lot of the medical stuff is exempt under the Privacy Act, which you're talking about, people not following the rules. And I think part of that is because there's a lot of them are, like you say, from got mates who are in politics who are concerned that if they follow poor privacy policy, which is what they really should do within the health sector, then they're accountable for what they do. Something you touched on with privacy as well that I have seen that is good if the practice were a bit better is in pharmacies, especially living in a small country town. I've seen quite a few people with disabilities who are very nervous about going into pharmacies because typical practice, especially if they're going in with a support worker, is a very loud conversation with the pharmacist at the counter about what medication they've got, how it's being applied, where it's being applied, what the condition is that the person has, whether it's being used properly or applied by someone else. And it's like, this is very sensitive personal information, and the sort of typical thing of everyone out in the country talks as though they're shouting at their neighbour across the back paddock. It's like, hey, where's that? Oh, I've got this ointment. What's that ointment for? Oh, I've got a sore such and such. It's not good. It's not good behaviour. Um, it's sharing personal information, and um, it can make people with disabilities much less likely again to seek medical help because they feel embarrassed, they feel belittled, they feel like they're having their rights eroded. So that's another area that I think there can be slightly better practice in, and just a little bit more aware of the sensitivities and the personal privacy. There are some people out in the country who are, I guess, they're a bit more resilient, a bit more rough and tumble, and they're like, oh no, just get into it and let people know what's going on. But I know there's some pharmacies in town which are much better at having a private conversation at a counter that no one else can hear, and there are other ones where they're happy to shout it up across the room, and that's not okay, really.
Yeah, no, fair enough. We might just leave it there, I think. If there's no one in chat who wants to come up. Yeah. We might close this stream down for today. Again, if anybody wants to come up and talk about anything they want, they can express their views and opinions and talk about their own experiences on any issue and topic you like. The ones I put out are just topic for the day. We can also just sorry, I'm echoing. So come up, chat about anything you want when you want. Free speech. And again, next year we're going to talk about mental health. We're going to talk about parenting for people with disabilities, and talk about single parent with a disability. And we're also going to talk about the old bugaboo, sex and people with disabilities and their rights to be able to access workers. It's an interesting topic. Hopefully I'll try and line up a few people to talk about that next year. But again, next Tuesday, the one and only Christopher Widows, Tuesday, 9:30 a.m, aka Steady Eddie. Been a huge fan of his since the 90s. So, okay. All right. Thanks, Chris.